Hey guys, and welcome back to Exo Medical Spa. Today we're just going to focus in on wrinkles. Now we've talked about prevention in the past, which we'll review again in practice, but we're going to talk about wrinkles and other places where prevention isn't necessarily the only thing you're going to do. What you have to do is actually just fix it. Or you're at the point where you have so many deep inset wrinkles that are actually present when you're not moving. Then we're going to talk about the bigger, bolder procedures that we can do to help really finish that off and improve the way you look. When we talk about wrinkles, prevention is always first. Skincare, of course, sunscreen, diet, staying away from the sun are all important factors. Now for emotion wrinkles, frown, forehead, crow's feet, we can treat that with Botox. So what Botox is trying to do is just reduce the amount of animation that you have so you're not ingraining those wrinkles. Now there's a couple places in wrinkles where you need other stuff such as PDO threads, such as fillers. We have these lines. I don't necessarily have it yet, but you'll see it on people with more laxity when you smile. You have these wrinkles or these parenthesis lines that run across the face. You can't necessarily put fillers here because fillers will just weigh you down and give you bulk. And we don't want bulk in certain areas. Perioral lines, I don't have them because I have a beard in place, but you'll see it on smokers. We used to call them smokers lines. Then we call them Starbucks lines as people who drink Starbucks have a straw. We'll get these lines as well. And that's a place where you can do Botox as well. You can do fillers as well, and PDO threads is really good for it as well. Going back to this part of the reason we get it, and I won't dive into the details because we have so many long conversations about this, but when your skin starts to fall and you smile against that falling skin, it causes these compression lines. Now you can take PDO threads, compression, lift it up, and relinquish some compression that helps the wrinkles as well. But now, if we have all these deep set wrinkles in, or if you don't like those other philosophies where you're like, I don't want fillers, I don't want Botox, whatever the case is, then we're gonna go to our trusted lasers to really laser off those wrinkles. And let's talk about the biggest laser I personally use. For lasers, feel free to contact us here and also set up a Zoom consultation or an in-person consultation, whatever you're comfortable with. But for me to do lasers, you'll have to come out to La Jolla and San Diego for us to do the lasers. In here at Exo Medical Spa, we only do injectables and a couple other things as well. But when it comes to lasers, you have baby lasers, you have medium lasers, and then you have the big boys. The least amount of downtime that you have, the most gentle of lasers, then you're not gonna get profound results. But the flip side of that is you won't have a lot of downtime. The bigger the laser you go, the more profound the results, the less treatments you have to do, but you have a higher upside on how much you can correct. But usually that entails a long period of downtime. Now, different types of lasers. You have needle-based lasers, you have straight lasers, you have different versions, Alex, YAG, CO2 lasers. So you have a different variety of lasers, but they also break down into how much damage they put into the skin. There's non-ablative, meaning that there's actually no damage to the surface of the skin. And that's usually the least amount of downtime. And then you have fractionated, where you take out a chunk of skin, you leave a good chunk of skin. You take away a chunk of skin, you leave a good chunk. And what that does is, because you're leaving good tissue behind, the recovery process is a little bit quicker as well. Not as quick as the non-ablative, but then you have this one that's fractionated, a little bit in between. It gives you fairly good results when it comes to color correction, pigment, textures, and fine lines. And the recovery time is anywhere from about 1 to 2 weeks, depending on how deep we go with that as well. But the last one is TRL, which is fully ablative. TRL stands for Tunable Resurfacing Laser, which I use at La Jolla. And what it does is it fully ablative. It takes off multiple layers of skin until we get down to good skin. But let's talk about it when I get back as well. But then we're gonna talk about what it actually does and how much correction you actually get. Now the media team will hopefully pull up some pictures. I'm just gonna pull up a whole bunch of examples of the elderly face where you have deep inset wrinkles, perioral wrinkles, peri-mouth wrinkles, these harsh parentheses lines, these frowns, all these deep set wrinkles. And no matter how much fillers you put in, how much Botox you put in, At some point, we've inflicted so much damage, so much age to our face that these lines, pigments, textures, pores are just deeply set in. So what we have to do is, this is an analogy I like to use, is think of it as a hardwood floor. Over the years, you ding it, you dent it, you stain it, and no matter how much cleaning you do to it, you just see all this damage on the hardwood floor. How do you refresh that hardwood floor? You just have to keep sanding it down and down and down until you get past that last crease, until you get past that last piece of staining, and you're restoring that fresh hardwood floor. Now, tunable resurfacing laser, TRL, what it does is similar. I'm taking a laser and I'm just taking off multiple layers of skin so I can get past that pigment, so I can get past that pore, so I can get past those deepest wrinkles around our eyes and around mouth to lay down a good foundation of new, good skin. The other thing I like about TRL is there's a heat component to it. The laser takes away multiple layers of skin, but if I add on coagulation or add on heat, it helps contract skin. Now, you have to be very careful on who you go to and how they use this device. You can't just use heat everywhere. If I use heat on the entirety of the face, yes, I want to contract the skin and make it tighten, but the face, the regular face, can't tolerate that amount of heat, and this is where you run the risk of burning and pigmentation, meaning that one, I can take away pigment from you, which you probably don't like, because if you're a tanner skin person and I put all these white blotchy spots on you, not gonna look good. Conversely, if you're any skin tone, if I use too much heat on you, you're gonna get hyperpigmentation. You're gonna have a bunch of round, random brown spots all over your face. So yes, we can use heat to contract certain tissue, especially around the eyes, but you have to be careful on where else we apply that heat. Expectations on TRL. Expectations, this is the most profound result you can get. I can take off pretty much all the wrinkles, all the pigmentation on your face within reason. Now, how do you prep for this? We're gonna put you on a very, very good skincare routine, especially if you are a pigmented person, you have melasma, or you're a tanner skin tone. We'll usually prep your skin anywhere from 2 to 4 weeks ahead of time with a bunch of skincare. During the day of procedure, we put topical lidocaine all over the entirety of the face. Now we give you some medications. We give you some opioids, or some pain medications such as Percocet. We give you Valium, which is an anti-anxiolytic, will put you in the happy place. And then lastly, I like to do a nerve block, because no matter how much pain meds I give you, no matter how much lidocaine sits there, it's still gonna be a little uncomfortable. So what I do is I do a dental block and I do a facial block. So I put lidocaine in certain places of your face where you have a lot of nerve bundles. And what it does is it makes you feel like you're at the dentist, where yes, you can feel the dentist pushing and prodding around, but you don't feel the pain. And then lastly, we have Pronox, which is laughing gas, and then we have a cooling device. It's like me blowing very, very cold air all over your face, which makes it comfortable as well. The procedure typically lasts about an hour, depending on how much I have to do. You're with us with an hour beforehand because you're numbing and taking some medications. And lastly, you're cooling off with us for about half hour afterwards. So the procedure takes anywhere from about 2.5 hours, depending on the size of the area, and then also how deep we go. Now, lastly, because you have medications on board, such as like you were going to surgery, we don't want you to drive yourself. So no Ubers, no Lyfts, no strangers. Has to be a family member, has to be a friend, someone you trust to take you home afterwards, because we don't want you operating heavy machinery, of course, if you're on medications. Now the post-care. Post-care with TRL, usually we want you indoors, strictly indoors for 5 to 7 days, because you're so red, you're so raw, you have so many layers of tissue taken away from you that you're unprotected from the environment. So we give you some pre-meds ahead of time. I forgot about that. We give you antivirals, antibiotics, and antifungals ahead of time, because we're taking away your protective layer. Now for 1 week, we want you indoors, only applying the stuff that we give you. We give you some face wash, we give you some creams, and we give you some other items to really protect your face from the environment. If you go out and about, sun damage. If you go out and about, sweat, dirt, all those things is gonna damage your results. Now, after 1 week, you're gonna still look pretty bad. You're gonna be oozy, you're gonna be weepy, you're gonna be dry, you're gonna be peeling. After about 2 weeks, you come back to us and you do a post-laser hydration. And we give you a facial with one of our estheticians, and they hydrate your skin and try to clean everything off. At that point, you're gonna look like you have a very, very, very deep sunburn. After that, you're probably fully healed. You can go put on sunscreen and go back to your normal skincare routine, minus acids, minus glycolics, minus retinoids, because we don't want to burn your skin further. And then depending on how deep I go, especially around the eyes, especially around the mouth where people gather a lot of wrinkles, you're gonna look like you have a tiny little sunburn. You're gonna be pink tinged for about a month, month and a half, because that area we go the deepest, it takes the longest to recuperate and build new tissue. And that's it, guys. So we talked about prevention for wrinkles, and now we're going to talk about the optimal way to correct wrinkles. Not everyone qualifies, but it's important to know we do have options. So again, if you like these conversations, give it a thumbs up, subscribe, make sure you share it to your friends and family as well. And if you want to see me for lasers, schedule a consultation here. I'll send you over to La Jolla where we can do the procedures there. I'll talk to you guys later. Bye.